Every April, the U.S. Department of Health and Human Services, the Office of Minority Health, observe National Minority Health Month to highlight the importance of improving the health of racial and ethnic minority in America.
It is an exclusive initiative that targets the health needs of African Americans, Hispanics, Asians, Native Americans, and other minorities. It builds awareness regarding the unequal burden of preventable death and sickness in these groups. It also promotes action through health education and early management of disease complications. In a multicultural society such as the U.S., access to health care for everyone is paramount for the country's continued progress.
And today, Marshall Minority Health Institute sponsored this event to address health literacy and language access.
The health and well-being of minorities are not just a modern-day concern. It had its roots many years ago when Booker T. Washington established the National Negro Health Week. Born on a slave plantation, he rose to become a leading African-American educator. Washington believed that the key to the progress of African Americans was rooted in the connection between poverty and poor health. He advocated for economic progress, not just through education, but through improved living conditions that included better sanitation as well as access to health care. And so Speed It Up today, we launched the Minority Health Month Foundation. It strives to lessen the health disparities experienced by minorities in the U.S., which are imbalanced by the quality of health and healthcare experience by groups based on their environmental condition and their social, racial, ethnic, and economic status.
The theme, Better Health Through Better Understanding 2023, focuses on improving health outcome for racial and ethnic minority community by providing them with culturally and linguistically competent healthcare services, information, and resources.
So I'm going to give you guys some statistics because I think it's important to, when we talk about minority health, we need to back our information with statistics. And I think this is really important information. So if you guys want to take notes and use it for your future information, this is great stuff here. So did you know that it is actually estimated that only 14% of the US population has proficient health literacy? 14%. And health literacy is so important for your own health, for your own wellness, and for your own life prosperity. Nearly 20% of the people in the US speak a language other than English at home. Like myself, I speak Chinese at home, and oftentimes I have immigrant parents and actually having to translate English documents, and that is a heavy burden as a 7-year-old, 8-year-old reading government documents that I still to this day do not understand what they mean. But with 20% of the US population speaking another language other than English at home, it is important that we have the cultural competency and the cultural sensitivity that that other people cannot understand English as well as we can. It is estimated over 60% of racial and ethnic minority patients over the age of 18 believe it is at least somewhat important to visit a healthcare provider who shares or understands their culture. Nearly 60% of racial and ethnic minority patients over the age of 18 believe it is important to visit a healthcare provider who shares or understands their culture. This is the basis of cultural competency and cultural sensitivity. And finally, in 2021, Office of Minority Health awarded $250 million to local governments to promote evidence-based health literacy strategies that are culturally appropriate.
Basically, it was started years ago by Booker T. Washington, who's an activist, educator, and philanthropist, founder of Tuskegee College. And so basically, he wanted to talk about the importance of health disparities as it relates to health equity. So back in the 1900s, he was already talking about health equity, which is access to all, despite your color, despite your sex, despite your income, despite what you look like. He wanted to talk about health equity, making sure that everyone gets adequate access to health care.
And how is it important for health literacy to the minority community?
Oh, it's incredibly important. When you know better, you do better, right? So when it comes to understanding your health care, knowing simply what it means to read a prescription and know how to take that medication properly. That could mean a lot. Increase education in that area to ensure that people know what they're getting into when it comes to healthcare initiatives and not be taken advantage of as well.
Okay, thank you so much. Yeah, the whole idea is that when patients are provided with cultural and linguistic appropriate health information, that would empower them for a better health outcome, not only for themselves, but also for their community. This is Ernest Kumba reporting for Community Use here in Huntington, West Virginia.